Welcome to the Mindful Practice Podcast, a space for physicians navigating burnout, identity shifts, and career change without pressure or judgment. I'm your host, Dr. Bertina Hooks, a board-certified internal medicine physician, coach, and writer. Here we talk honestly about what it means to build a sustainable career and a life beyond medicine and survival. Welcome to the Mindful Practice Podcast. I'm your host, Dr. Bertina Hooks, a board-certified internal medicine physician, entrepreneur, and coach. Let's talk about burnout, not in the way you're used to hearing it, because most of the conversation around burnout focuses on symptoms, exhaustion, emotional and physical fatigue, wanting time off. And while those things are real, they don't actually explain what's happening underneath. So what ends up happening is physicians try to treat burnout at the surface level. They take a vacation. They reduce their work hours. They try to rest. And sometimes that helps temporarily. But when they come back, the same feeling returns. And that's where frustration builds. Because now it's not just, I'm tired. It becomes, why isn't getting better? Here's the shift that changes everything. Burnout is not always the problem. Burnout is a signal. Instead of treating burnout like a personal failure, treat it like a dashboard light. A dashboard light doesn't mean you're a bad driver. It means something needs attention. And if you keep putting tape over the light, more caffeine, more grit, more pushing through, you don't actually solve the problem. You just stop seeing it. So the question isn't, how do I make this go away fast? The question is, what is it pointing to? Burnout is a signal. Most physicians don't start in full burnout. They start with what we talked about in the previous episodes, a sense that something is off, a misalignment. They're still functioning, they're still performing, they're still meeting expectations, but internally there's a disconnect. You have less patience than you used to. Your energy drains faster. Work that used to feel meaningful now feels neutral or even heavy. And because you're still able to function, it's easy to ignore. But over time, that disconnect compounds, and eventually it shows up as what we would label as burnout. So instead of asking, how do I recover from burnout? I want to ask you a different question. What is it trying to show me? Because burnout, when you break it down, is usually a sign of misalignment, dissatisfaction, disconnection. And there are three main types of misalignment that show up in physicians. Role misalignment. The job description and the daily task don't match how you want to practice now. Environment misalignment. The system, culture, incentives create constant friction, even if you still like the core work. Value misalignment. What matters to you has shifted, but your work structure hasn't shifted with it. Here's a simple framework you can use. When burnout shows up, Most people jump straight to solutions. But if burnout is a signal, you need to interpret the signal before you act. Here's a simple 4-step framework I teach physicians. Signal. Name what's happening without judging it. I'm dreading clinic. I'm numb. I'm more irritable. Identify which type of misalignment is most likely. Role, environment, or values. Test. Run a small experiment to gather data. Before you overhaul your entire life, set one boundary. Make one schedule change. Take on one new responsibility. Have one conversation. Adjust. Use what you've learned to make the next move. Bigger if it works, different if it doesn't. This keeps you out of the all or nothing thinking, and it turns burnout into information you can actually use. Now let's talk about the different types of misalignment in more detail. Role misalignment is when you don't enjoy your current role. It no longer fits how you want to truly practice. You might still be a great surgeon or internist. You might still excel and perform well, but something about the work no longer aligns with you. A physician, for example, who is excellent and competent clinically, but feels drained by high volume patient care. They don't dislike medicine. They dislike the structure of how they're practicing it, the pace, the repetition, the lack of time to think. So they assume they're burned out. But when they transition into something more analytical, like utilization management or advisory work, they feel different, more engaged, more focused, less depleted. Same physician, same skill set, just a different role alignment. Now let's talk about environment misalignment. This is when the issue isn't the work or role that you do, it's the system you're working in. You might enjoy patient care, but the environment creates constant friction. Leadership that doesn't support you, policies that limit your autonomy, administrative burden that outweighs the meaningful patient work. So you end up exhausted, not because of medicine, but because of the environment. And I've seen physicians move into different systems. I've even moved into different systems. The same type of work, but a different environment, and their burnout improved significantly. Not because they changed, but because the environment did. Finally, there's value misalignment. That's deeper. And this is when what you're doing no longer aligns with what matters to you. Maybe earlier in your career, stability was the priority. Now it's flexibility, or impact, or autonomy, or financial growth. And if your current role doesn't align with those values, it creates internal tension, even if everything else looks fine. So here's why this matters. If you don't identify the type of misalignment, you can't fix it. If you treat role misalignment like burnout, you'll rest but still feel off. If you treat environment misalignment like a personal issue, you'll blame yourself. If you ignore misalignment, you'll stay in a role that no longer fits your life. So the goal is not to say, I'm burned out. The goal is to diagnose what's underneath. So I'll give you an example. I call it the orange juice example. So you have an orange, and if you squeeze it, it will produce juice, either bitter or sweet, depending on the orange. Now, Imagine that the orange is you, a physician, and if you are put under pressure, which is the squeeze, those chronic stressors from your work, you can produce juice as well, and it can be bitter or sweet, and that depends on what lies within you. You can be put under the constant pressure and stressors of your job and excel and become a leader, an innovator, a thought leader, a speaker, an advocate, or you can also become burned out, depressed, anxious, irritable, physically, emotionally exhausted. But the type of juice you produce depends on you on the inside, your internal dialogue. Think about it. I think it's a very important analogy on how we deal with different types of stress and pressure and how it can shape us and mold us, just like a piece of coal is transformed into a diamond. So, make this practical. If you're listening to this and thinking this resonates, here are some questions I want you to ask. Where exactly do you feel friction? Is it the work itself? Is it the environment? Is it the leadership? Or is it what I value has changed? And then let's go one level deeper. What would the opposite look like? What would your ideal job look like? If it's role misalignment, what type of work would make you feel more aligned, more energized? Would that be academic work, research, and teaching? Would that be non-clinical work such as pharma and biotechnology or utilization management? If it's an environment misalignment, what kind of system would support you better? For me, I transitioned to a different role because of environment misalignment. The leadership didn't support me, and so I transitioned into a different role where the leadership did support me. And that is how I am enjoying my current role, because I have leadership that supports me and helps me maintain a role that is sustainable and aligned with my values and goals. If it's value alignment, what do you actually want more of? For me, when I transitioned to locums work, I wanted more flexibility and autonomy, more financial freedom. When I transitioned to non-clinical work, I wanted to work more remotely. I wanted to have more time for family and more work-life balance. This is important because once you name it, you can start to change it. And that's important. And that's where most physicians get stuck. Not because they can't change, but because they haven't defined what needs to change. Burnout is not a dead end. It is data. It is a signal. And when you use it correctly, it becomes the starting point for something better. If this episode resonated with you, if you're starting to realize that what you've been calling burnout might actually be misalignment, I want you to start with the Burnout Career Reset series. It will help you break this down clearly, understand where you are, and start identifying the next steps. Because once you understand the signals, you can find clarity and direction. Thank you for listening to the Mindful Practice podcast. If today's episode resonated with you, you can find free burnout and career clarity resources at pinnaclebusinessacademy.org. And if this podcast supported you, please consider subscribing or sharing it with a colleague who might need it. Remember, you are more than your white coat. You are not broken, and you are allowed to evolve. Until next time, take care of yourself, not just your role.